South Africa has reintroduced tough pandemic restrictions amid a third wave of coronavirus driven by the fast-spreading Delta variant. For at least 2 weeks, gatherings and alcohol sales have been banned. There's a curfew and schools have been closed. That includes one town in the Western Cape where residents were hoping they'd be lucky enough to get through the pandemic unscathed. Christine Mundwa reports.
No one in the small remote town was known to have been infected with the coronavirus since the start of the pandemic. But that changed in the middle of June when 3 people suddenly died from COVID-19 related complications just hours apart. One of them lived in this house. Hendrik Okhuis was a retired miner. He was 75 years old and diabetic.
And then my sister told me on Sunday morning that something is wrong with his chest. He couldn't breathe properly. And I said, maybe you guys must phone the ambulance. And then my father said, no, he's doing fine. My mother must just help him, putting on some ointment on his chest to help him to breathe properly. And I talked to him and I asked him, what do you want us to do for you? And he said to me, you guys must just pray for me, that's all. And I said to my sister, just keep me updated. How is he doing? What's wrong with him? And then we can take it from there.
The deaths raised the alarm, prompting local health authorities to probe the spread of infections in the community. Testing revealed that almost a quarter of Kliprand's 250 residents were infected. Ari Kluter is the community spokesperson. He told us people here were caught off guard.
This COVID hit us with a bang. We weren't prepared for it. Since the last 15 months, we were totally free since March last year when COVID started here in South Africa. And suddenly it hits us with a bang. And as I already mentioned, we weren't prepared.
There's a clinic right in the heart of the community, but it has no capacity to provide care for people who are seriously ill. The closest hospital is about 200 kilometers away. While most people who tested positive here hardly experienced any symptoms, no one wanted to take any chances.
I was negative, but my cousin was positive. So I decided I want to do it for him, because if I was positive, then he will do it for me also. That's why I stay in my house, in my room, and quarantine also, because I don't want to infect some other people, or I don't want to have to be infected. That's why I quarantine myself.
Residents agreed to impose a quarantine on all of Kliprand's 65 households to slow the spread of infection among the people of this tight-knit community. Everyone isolated from each other and the outside world. However hard it might have been, the exercise proved rewarding. Most people are now free of the virus, and there is the general feeling that the worst is over for Kliprand. But just as people felt safe to come out again, with youngsters resuming pastime pleasures like this game of rugby, fresh nationwide restrictions mean the newly found freedom will be short-lived.
And DW's Christine Mundwa, who filed that report, joins us now from Cape Town. Christine, that small town in your report, it's been hit really hard by the pandemic. Are there likely to be many more towns like that, though, in South Africa?
Certainly, Terry, that is the likely reality. There is not enough testing happening in South Africa at the moment. For example, in the last 24 hours, our country managed to test only about 50,000 people. This is a country of nearly 50 million people. So that gives you a sense of just how limited the visibility is into just how far infections have spread. Indeed, in major cities like Cape Town and in small communities like Kliprand, which are really on the outskirts of the country.
What sort of support is available for smaller towns and remote villages in South Africa that end up getting hit by COVID-19?
Well, this is what we're learning, Terry. There isn't enough support. In the case of Kliprand, it took the deaths of 3 people. And then, of course, the authorities realized something was wrong and rolled out that mass testing. But that has always been the challenge, that people who live out in the rural areas, as we call them here, these are the people who lack access to hospitals. For example, people in Klipbrand, the nearest hospital is nearly 200 kilometers away, Terry. There's a long dirt road. So people understood there that because of their being out in the remote part of the country, they had to take action on their own. And you saw that initiation. They decided they had to quarantine on their own because if somebody really needed to get to a hospital, it would have been a real challenge to get them there. So these are people who luxury healthcare, Terry, is essentially a luxury because they don't access it. And we see that the health sector doesn't reach the areas where they are.
Okay, well, wherever you are, in a big city or a small village, access to healthcare is crucial, especially in a pandemic. How is South Africa and other parts of the continent doing in providing that access?
Terry, the pandemic has really revealed just how dire the situation is in terms of this country's healthcare sector, but not just this country, the whole of sub-Saharan Africa is essentially. From the beginning, you heard of frontline doctors and nurses dying on the job because there wasn't enough PPE. This could be any country, basically, in sub-Saharan Africa. The healthcare sector is on its knees in this country and across the region. Not enough investment has been made. There just aren't enough hospitals, clinics. There aren't enough personnel as well. At some point, South Africa invited doctors from Cuba to assist. This was in the second wave. And you're already hearing reports of there being overwhelmed hospitals, people being turned away or made to wait for days before they can get an ICU bed. So the infrastructure here is limited, and we're feeling it now, especially in hotspots where infections are peaking, not just here in South Africa, but across the region as more and more people battle coronavirus, and there are just not enough resources. So you're certainly hearing it from bodies like the IMF urging for more investment to be made in Africa's healthcare sector, because resources here are very much limited.
Christine, thank you so much. DW's Christine Munwa there on a rainy day in Cape Town.